I think that although Angela and I have differences in how we got here, why we got here, we have a common thread, and that's the difference that we can make for the patients and the communities that we serve. So I came from a family that definitely had a lot of experience in the medical field. My father ran the ambulance service and worked the ambulance service from many different arenas, from driving it to driving the ambulance to delivering care to then eventually running it for the entire county. And that is a pretty tumultuous position, 24/7 on call, and you really hear and see the strain that that can have from a healthcare perspective. And my mother started out in nursing, and then she went from nursing to being a nurse midwife, then an OBGYN and a family practitioner. And we lived in an area that was very underserved from a healthcare perspective. The hospital shut down on multiple occasions in the same situation now, and the strain of COVID has put even more strain on underserved communities. And I mentioned social determinants of health. We didn't call it that when I was growing up, but it was everywhere. And I remember my mom would see over 100 patients a day, very, very often. And she would go in at 7 in the morning and she would work to 7, 8, 9 o'clock at night. We would have patients that were knocking on our doors in the middle of the night because there wasn't a hospital, because they didn't have a place to go, because they couldn't afford health care. And she always opened the door and was there for them. And it was always about the community that she served. It was always making a difference. And when you look across my siblings, one was in law enforcement to serve the community, the other two in healthcare, and my sister runs a lot of health aspects of healthcare for the entire school system, and making sure that underserved and underprivileged children can have food on the table, have the healthcare they need, can have clothes on their backs. So for me, when I think about the impact and the influence that's had on me, it's been profound, because it shows that everyone doesn't have at their fingertips what they need to be healthy. And even simple things that we can take for granted, such as having food on the table, is not guaranteed for everybody, even in America. So we have to work together to make sure that our communities really have what they need to be healthy. And within underserved areas, healthcare is so important because it's really the cross-section of where everything comes together to help support your community. And I saw that with my mother. I saw multiple women speak to her in tears, and they had dropped out of high school. They already had children, and that was her path. She had multiple kids before she was 20, and she went back and she gained all of those degrees, graduating at the top of her class with 3 and 4 children at home. So it was also the passion, and Angela mentioned this earlier, the passion of knowing the purpose you serve and never, ever giving up. So the influence that's had on me when I entered into healthcare, and I have a degree in chemistry, and I could have went on and got my PhD, and I said, I don't see myself in a lab. I had also been working in clinics for multiple years when I was in high school as well as in college, volunteering. And I had a passion to help patients, and I had seen that through my upbringing. And biopharmaceuticals unfolded to be the perfect path. And I was with Searle, Pharmacia, now Pfizer through mergers and acquisitions. I've had 12 to 13 different roles across strategy, marketing, multiple aspects of business, and leading teams. And at the end of the day, always being grounded in the patients and the communities that we serve. As long as you always have that as your front and center, then everyone at the end of the day will have a better outcome. And that's the passion of making sure that you don't take tomorrow for granted. And if you can make that difference today, you need to do so and lean in on making that difference.